Good morning.
Morning. Morning.
Everybody's awake. I'm David Harkey, Director of the UNC Highway Safety Research Center, and on behalf of the Department of Psychology, the Injury Prevention Research Center here at UNC and the Highway Safety Research Center, I want to welcome you to the Patricia Fossum Waller lecture series. So I want to start by introducing the lectureship. This is, as I said, the Patricia Waller lecture that was established several years ago. We've had several of these now. Pat was a longtime staff member here. She actually started with the Highway Safety Research Center back in 1967. Was there for a couple decades. And in 1987, she became the founding director for the Injury Prevention Research Center. And then was there for a little bit of time before she left to take off to Michigan, where she was director of the University of Michigan Transportation Research Institute, and led that center for the better part of a decade before she retired. For those of us that had the opportunity to know Pat, work with Pat, she was a leader in the field. We learned an awful lot from her, and there's still a lot of things that she was very forward-thinking in a lot of the things that she did. She was pushing graduated driver's licensing before most of us knew what graduated driver's licensing was. It just took a couple of decades for us to kind of get around to realizing that was a really good idea. But one of the things that I wanted to do quickly in the introduction to the lectureship this morning, we had the opportunity a little over a year ago, I'll call it an opportunity, to repaint, recarpet our offices at the Highway Safety Research Center. It was an opportunity for a lot of people to clean out their offices, and a challenge, as you might imagine, for some folks. But one of the things that I discovered in the process was I found the original application for establishing the Institute, for establishing IPRIC. And so this properly belongs with IPRIC. This goes in your archives, Steve.
I'm just going to change the date.
And so I'm going to give this to Steve. And so this was a wonderful find, actually, that we found. Who would have thought we would have found an application that far back? And so I'm going to give this to you, and you can take it and put it in your center now.
Thank you. Oh yeah, I see a lot of stuff we could recycle.
There are a lot of names in that proposal that a lot of you are sitting in this audience today. So let me move now to introducing our speaker. It's a real honor to have Dr. Shope with us today. It's been a couple years since we've done this lecture with a focus on a highway safety issue, and so it was perfect timing. It worked out for her. It worked out for us in terms of those who manage the lecture series to have Jean come and visit with us today. She is a research professor emerita in the Young Driver Behavior and Injury Prevention Group at the University of Michigan's Transportation Research Institute and in the Department of Health Behavior and Health Education at the University of Michigan School of Public Health. Prior to that, she served as head of UMTRI's Social and Behavioral Analysis Division from 1995 to 2005 and as an associate director of UMTRI since from 2006 to 2012. Over the past 3 decades, Dr. Shope has been involved in research addressing adolescent risk behavior with a motivation to especially reduce risk to adolescents of being involved in motor vehicle crashes. She has an extensive background in funded behavioral science research, and having served as the principal investigator in a major longitudinal study that addressed teen and young adult risk factors for crashes. She has also evaluated graduated driver licensing and teen driver interventions directed toward parents. In addition to her research efforts, she directed the University of Michigan's Center for Injury Prevention Among Youth and is a co-founder of the University of Michigan Injury Center. She has received several awards, particularly the University of Michigan Research Faculty Achievement Award, the Widmark Award of the International Council on Alcohol, Drugs, and Traffic Safety for outstanding, sustained, and meritorious contributions to the field. And so it's a great honor. She's a longtime colleague of a lot of us at the center, and so we've been involved in a number of research projects with her over the years, and so it is absolutely wonderful to have her here today. Chief.
Thank you, everyone. It sort of feels like a second home. We have a lot of good connections here, and I'm very happy and grateful to be here. Thanks for those kind remarks, Dave. So here's Pat, the way she looked when she was directing our institute from '89 to '99, 10 years. And I just want to say thank you to the Waller family for sharing her with us and for inviting me here today. As I was cleaning out some things and checking with our librarian, I actually found a reflection that I wrote in 2003 when Pat passed away. And, you know, first I didn't want to read it for fear I had said something I wouldn't like anymore. And then I thought, you know, this isn't bad. So I'm going to share a little of this with you because Pat meant a lot to me and to all of us at Umtree and at the whole university. So many of us in those years got totally swept up in her enthusiasm. Some of you can relate to these things, I think. Enthusiasm for plans and projects we worked on collaboratively with her. She led by example, constantly challenging us all to become involved, to grow professionally, and she pushed forward the transportation issues that she cared passionately about. She was fearless in speaking up and taking on causes because it's the right thing to do. And her strong principle of fairness, her broad vision guided her behavior and shaped our behavior. She chose difficult goals, used innovative approaches, and showed us how to overcome obstacles. We doubted that we could possibly take on any more when she provided us with opportunities that we just can't pass up. I used to sort of anticipate when I heard her footsteps coming down the hall that another opportunity was coming. And we wondered if we were good enough to accomplish what she had often already told others that we could do. But her energy, integrity, and persistence inspired us to accomplish many more tasks and to do them better than we could have imagined. So thank you, Pat. And this picture you have in your program, but at Umtree, our artists did a color version, which is now framed in our conference room, and my iPhone took a terrible photo of it, so I can't show it to you in color, but it's very vibrant, and we love having it there. So thank you again for inviting me here, the HSRC, the IPRC, and the Department of Psychology. And the things I want to talk to you about today are shared projects with colleagues Bruce Simons-Morton, Ray Bingham, and Jennifer Zakryzek. And of course, we couldn't do any of this without our sponsors, NIH, Bruce's Institute of Child Health and Human Development, and of course, CDC's NCIPC. So what I'll try to do today is, I don't have to do too much on the motor vehicle side because you have good people here who've reminded you of those things. We do have some evidence-based programs that I want to share with you. And then I'll particularly focus on a program called Checkpoints that's directed to parents of teen drivers and tell you about a series of 4 projects that we did, first testing efficacy, then effectiveness, and then translating it for wider dissemination. And of course, the implications for policy and practice and more research. We can say that right now. We always need more research. So what do we know about teen crashes, teen driver crashes? From CDC, thank you, Whiskers, fabulous data source. Anytime you need data, we know that unintentional injuries are a leading cause of death in this young age group. And you can see 64% of those unintentional injuries are motor vehicle in this age group, 15 to 19. That's both sexes together. So in 2010, 7 teens died every day from motor vehicle crash injuries. Per mile driven, teen drivers were 3 times more likely than 20-year-olds, 20-plus-year-olds, to be in a fatal crash. Male teens, 2 times as likely to die as female, and almost 300,000 were treated in emergency departments. Big problem, huge losses. We still have a long way to go with this. And then there's the cost. Young people in this age group, 15 to 24, are only 14% of our population, but account for 30% of the motor vehicle cost, that's the males, and 28% for the motor vehicle injury costs among females. And these are preventable for the most part. So let's get busy looking at what we can do. As a group, the teen drivers crash more in the very first months of driving on their own, when driving at night, when driving with teen passengers, and one study shows particularly male passengers lead to more risky behavior. If they're younger when they're licensed, if they're male drivers, and of course if they've been drinking alcohol. And they're more likely to be injured if they're not using seat belts, and teens may not be using them as frequently as adults. So what do we know about individual teen drivers? Did anybody notice anything funny about this slide? Oh, you're really alert. That's good. This is from Australia, where I've had the privilege of working some, but their drivers have the same problem. So all over the world, when young people are learning to drive and also developing in the ways young people do, there are higher crash rates everywhere. We did a longitudinal study, and that was a study I did actually with Pat Waller from the National Institute of Alcohol Abuse and Alcoholism. And we were able to follow a huge group of young people and discovered some did crash more and have more offenses. And they tended to be those who used substances, who had friends who used substances, who reported themselves to be more susceptible to peer pressure on the index we used, more accepting of deviant behavior, easy access to alcohol and marijuana. They tended to live with only one parent and felt their parents were rather lenient about teen drinking in particular. They felt less connection in their family, and they told us their parents did not monitor them very closely in terms of where they were, who they were with, that sort of thing. But all teens are at risk for crashes, not just the ones with those risk factors. And it's because they're young. They're still maturing, still developing. You know the thing now about brains not developing till age 25 or so, particularly among young men. So we have this to deal with, and more distractions. I don't have to tell you how much that is a factor now. But young people have no experience driving, and they've got to gain all the experience that the rest of us have somehow during that learning process. So they're not recognizing hazards as well as an experienced driver. They're speeding, and they're having shorter headway and unable to stop in time sometimes. But driving's really important. How many of you have had a teen driver some point or are going through it now? Okay, you know. They want to drive. You actually want them to drive because it would help in a busy life. It's an important milestone. Developmentally, it's a nice step toward independence, but they're still maturing. And driving is really risky. That's a heavy-duty, big machine that can do terrible damage if misused. So it's the goal of everybody, parents, driver educators, law enforcement researchers, even the teens themselves. I remember Pat often saying they actually don't want to crash. We want them to have a safe experience, so we teach them to drive. And here we have the mom very gently saying, okay, let's try it without loading the CD player and answering the cell phone. And the girl is saying, hold on, my mom is saying something to me. So we're trying to teach them. And you can see here what a nice low risk crash risk goes on during this learner period. And then bam, they're off on their own, and this huge jump of crash risk is something that we're all focusing on trying to lower. As they gain experience, it goes down, but this is a pretty impressive figure to show parents. So what approaches do we have to reduce teen drivers' crashes? And seeing this police officer here reminds me that in 2003, Pat wrote a summary of where we were with all this, and she said, there is no evidence in the literature on learning that increasing threat helps inexperience. Very good point. That police officer is not going to help a kid drive better. We have to find some other ways to do that. So the best ways, and you've already heard Dave mention graduated driver licensing, which Pat was very instrumental in getting going in the country. And when she moved to Michigan, she was up in our state capitol testifying and arguing, and we managed to get a very good program put in place fairly early with North Carolina not far behind. And you all know Rob Foss, so anything I'm telling you, if he's talked to you, you've already heard most of this in his version. And I'm sure he'll make me toe the line and say it all right here today.
Question.
Not yet.
I'll take care of you.
Thank you, thank you. So all states in the US now have graduated driver licensing, which is these 3 stages. Usually the first stage incorporates a lot more practice than it used to, supervised driving, usually by the parent. Then the intermediate stage with restrictions that are typically driving at night, driving with passengers, and now more and more regarding cell phone use. And we've done several evaluations, and that was one of the first projects I did with Pat and met Rob through doing that. We evaluated the Michigan program, and now we've had many more evaluations, and we continue to see nice reductions in crashes, fatalities, injuries, especially among that youngest age group. And when we were applying for a grant recently and looked for effective programs for teens, the only other one that we could find was the Checkpoints program that I'll be telling you quite a bit more about later. But we felt this program would enhance GDL. GDL alone can't do everything. Parents really need to be actively engaged in using the program to help their young people along. So the ways to maximize GDL's benefits, because kids were still crashing a lot, even though they were crashing less, we need to implement it, enforce it better. And the other thing we thought we should be doing is enhancing the role of parents. But it was kind of challenging. A lot of parents were thinking that, oh, my kids had driver ed, they're fine, they're ready to go. Parents are really, really busy, and you know that from being busy. There's just a lot of stuff to fit in the day, and then we ask them to do more. Many parents think their teen will be fine. He's responsible, he gets good grades, captain of the whatever team, it's all good. And others have thrown up their hands and decided kids don't listen to me anymore, which is not true, by the way. They really do care what you think, even if they pretend they're not. So don't give up. And parents' role in teen driving is fairly extensive. They're the ones who can and actually should decide if this particular teen is ready to start driving. They're the ones who give permission for their child to learn, to get licensed. They often are the supervisors most of the time. They actually know their teen very well after many years of living together. They own the car. They have the keys in their hand. They pay for the insurance, the gasoline, the repairs, and they're the ones who can enforce the GDL restrictions. The parents really can't. So what can we do to help parents help their teen drivers? So Bruce Simons-Morton at NICHD developed a program called Checkpoints, a parent-directed program with these objectives. raise parents' awareness about the risk. And lots of studies have shown parents think drugs or lots of other things are the biggest risk to their youngster. They're kind of surprised to learn it's actually crashes. We need to encourage parents to adopt a written parent-teen driving agreement. That's a very important objective of this program. And then encourage them to set restrictions on that early driving independently. Probably stricter restrictions at first than the GDL program might require. And parents need to be involved in monitoring that early driving, not just assuming they're okay, ready to go off on their own. And this program's goal was to reduce teens' risky driving, their offenses, and their crashes. So Bruce did a series of studies where the program was essentially self-administered. Materials were handed out at driver licensing settings. And the intent was to facilitate the monitoring that the parents were to do and the limit setting based on protection motivation theory. Those of you from health behavior will be glad we're using theory. We have to keep reminding our students it's a good thing to do, actually works. And the program has persuasive messages, but the linchpin of the whole thing is this written parent-teen driving agreement, which has kids start out in low risk conditions. Then as they show responsibility, they can gain privileges, and a checkpoint for the teen and the parent to get together and think about whether it's time to review how they've been doing and add some privileges. So as I said, it was administered mostly through licensing offices, and the early studies showed promise that you could increase agreement use. And agreement use means they're actually talking to each other, which is a great accomplishment by itself, and reduce risky driving. But there was limited uptake. Not everyone used an agreement. So in collaboration with Bruce, we didn't know that the first study would soon become a series of studies. It makes it sound like we actually had a research program and we knew what we were doing, but you can make it look good afterward, that's okay too. So the first one was in driver education, and we made it more into a brief intervention face-to-face and tested the efficacy of that setting. And the second study I'll tell you about was looking at effectiveness, where we trained driver educators to administer the program. And then we did a study where we developed a statewide distribution plan using a web-based interactive checkpoints program. And then we also had another study where we were working with pediatricians to have them do a brief intervention and get people to a new second website. So I'll tell you about these studies and we'll see what happens with it all. Driver education seemed like a really good setting. It was one point in the busy time of your teen growing up when parents were paying attention, had to sign some things, had to agree. So we thought it'd be a teachable moment. And in Michigan, and here too, driver education is required if a youngster wants a license before age 18. So we thought being in the classroom with parents and teens together would be a good place to have this discussion and get them to sign an agreement together. Having it face-to-face, having it small group, having it be a brief intervention, we thought would be stronger than the early studies of just handing out the materials and doing some mailings. So our first study was a randomized controlled trial. In a large driving school, we randomized the classes, and we had 344 parents with their teens, some moms, some dads. And we worked pretty hard to adapt Bruce's checkpoints to Michigan's GDL and to sort of jazz it up, add some color and our own touches on it. And we had a health educator go in the classroom, a special session where parents and teens came together, led the session, and our comparison group, not quite a control group because the driver ed people were reluctant to have a control group, they got nothing. They actually got the National Safety Council's Family Guide to Teen Driving, which on page, I think it was 46, actually had a checkpoints agreement. We didn't point it out, but that was our comparison group. This is what the agreement, written agreement, looked like. And you can see there checkpoints 1, 2, 3, 4. We have already filled in for this study the recommendations that we would have for people to fill in about driving at night or with teens or weather or roads, when they're going to review it again, and initial, both the parent and the teen. So again, encouraging communications. So I'll shorten this study so I can say more about the others, but it was published in Family and Community Health, and we did find that the checkpoints parents, compared to the comparison, were more aware of teen driving risks, were more likely to use an agreement, were more likely to set recommendations the way we, restrictions the way we recommended, and to report they actually used the materials, discussed them with their teen. So it was very feasible to do this. We had a slick program ready to go, but only 30% of those eligible parents from those class registrations came. And they had lots of good reasons. They were really, really busy. And we'd like stronger effects, of course. So we went on to the next level when CDC was ready to fund us. And here we thought, well, why don't we train the driver educators to deliver this? They already have some credibility. They're expert at, the parents think they're the professionals about driving. Sometimes in small towns, they're very well known to each other. So we did another study that ended up with 152 parent-teen dyads, but again, a controlled trial, and this time the control group didn't get anything. Here we developed training materials. We actually videotaped a sample classroom session so we could show it. There was an instructor guide with the protocol, sample script, although they were encouraged to personalize it a little bit to their community and what they knew about their families. We did a 2-hour training. We actually had them practice delivering it. We monitored them later and found they were very reliable in delivering it. We added another poster for our classroom discussion, the one I showed you, and I'll show you again. And we also had the agreement finally have parent responsibilities. I'll show you that. So, oh, we're having our warning. Yeah. But it isn't so loud in here that you have to cover your ears, and I'll just not say too much in case you can't hear very well. But it is just a test, so. Only Liz is leaving. And this time we also had a take-home booklet that kind of reviewed the points of the session and had an extra copy of the agreement. So in that classroom session, we had the parent with the teen. They sat next to each other. There was an introduction and then a video, Who Wants to Be a Driver, which was done at NICHD, kind of has a news report way of interviewing families who use this agreement, and of course they thought it helped them out. We give a few persuasive messages and show some posters that I'll show you that we would put up on the blackboard tray, and parents referred to these. And then we walked them through the written agreement, so they sat and had time to go through each of these things together. It was pretty interesting overhearing them negotiate. One young man saying, well, if I can't drive friends in the car, what's the point of having a license? And Mom said, yeah, but then he decided he did want a license, so. Very interesting. And at the end, we did this little thing like, how many of you are gonna have night restrictions start at 9 o'clock? And they'd raise their hand, little moral support. So these are the 4 figures that we showed them. Nice, simple things. They were pretty impressed. The younger, the more crash. We showed them this one, very impressive. The nighttime crashes, the red line at night, and obviously much higher for the younger drivers. And this classic one with the number of passengers for the youngest drivers, when you're up to 3+ passengers, huge increase in risk. Parents found these impressive. They often pointed to them when they were filling out their agreement with their teen. And this was timed so that these teens were just about ready to go take their road test and get their license to drive alone. And we thought that was really a good time to get parents amped up about this. So the agreement looks like this, blank, and it was still a written paper agreement. But here's the part where hit the wrong one, where the parent will be a good role model behind the wheel, point out and discuss safe and dangerous driving situations, apply rules fairly and consistently, consider necessary exceptions. Obviously, the world is never quite as predictable as we'd like, and provide a safe ride home when asked, no questions. So that's what they would sign, as well as the teen driver following all the good safety rules. So I'm going to whiz through the results from this study, but you can see the huge red bars. The intervention group really used a written agreement way more than the control group. Wave 1 was at licensure, wave 3 was month 3, wave 4 was 6 months out, and we were amazed that they were still using an agreement. Of course, by then, there may have been some interesting infractions that made them decide, we do need an agreement. And this slide just shows the percentage of teens with limits that met our recommendations, and there were significant differences, again, far out to 6 months. The number of teen passengers, the difference was like 1 teen passenger per group, which is pretty amazing. The night driving limit, this is Sunday through Thursday, almost an hour different, and for weekend, almost an hour different. Well, these are things that could really make a difference if your teen is protected a little longer with these sorts of things. So in 6 months, when we asked the young people about their risky driving, we did still have a significant difference in overall high-risk driving, particularly driving 20 miles over the speed limit and going through intersections on yellow lights. We didn't have enough kids or enough time to discover a difference in offenses or crashes. So to summarize those results, randomized trials, 6-month follow-up, a comparison group, and the checkpoints teens and families used the agreement 4 times as much as the control group, had more driving restrictions, 3 times on the teen passenger, and less risky driving. So we had better results, that was good, but we still only got 35% of the eligible families to come. So what next? We figured maybe if we thought about how to disseminate this further, and at that time CDC was beginning to put out calls for translation work, and that would follow an evidence-based study like we already had, but moving science further out to improve health. So their goal, stated in one call for applications, was to accelerate translation of proven effective interventions into public health practice. Translation is implementation, dissemination, diffusion studies to understand how these interventions get out. That was just what we needed, and we were successful to get some funding to do the web-based study. We thought that if this agreement was available on the web, parents could do it on their own time, late at night, early in the morning, whenever, and we would test the fidelity of our new web checkpoints program to the earlier paper-based and brief interventions. And we developed a promotion plan, had partners around the state, and we wanted to measure the additive effects of those various promotions and then see about dissemination, institutionalization, and cost. So we developed a website. This one is still alive, although this project will be ending shortly, and it was Michigan-based. And it was set up so that if parents registered and developed an agreement online, they would get email reminders that it's time to update your agreement, time to sit down with your teen driver again. It matched with the fidelity. We did focus groups to have them test the 2 different ways of checkpoints. And we got the promotional plan going, and we're learning to use Google Analytics to see what happens. So our promotional partners were various state agencies, driver ed groups, school groups, organizations, and with the state health department, we had an advertising agency that helped with some of the promotion. So the phases of evaluation over this 16-month figure included first just putting a link on the various partners' websites. On the state licensing website, on driver ed schools website. And then we did a more active promotion where they would actually promote these links through some earned media. And then we did paid media, including Facebook. And then the whole combination was what we called the model program. This is what one of the Google Analytics approaches looks like. We could see what the referring sites were, and of course our goal down here in the bottom, you'll see more of this slide again, is to have people hear about the website, go there, look at the material, download them, make an agreement, sign an agreement, use an agreement. And we found that we had lots of visits. 1.6 minutes average and 2.4 of our web pages, but 66% bounced. They only got to the home page and then left, and 3% registered to use the interactive agreement, which of course we were hoping they would do. The visits increased with each promotional phase. We did find that earned media gave us better engagement and of course cost less. Paid media got more traffic, but they bounced more. The Facebook advertisements were probably not what we would recommend people use. So it's certainly a more sustainable delivery mode, more accessible, but it clearly needs promotion. And that led us, at the same time we had another opportunity to apply for funding, and collaborated with the American Academy of Pediatrics with their PROS group, Pediatric Research in Office Settings. It's been an interesting experience, a good one, and that project is winding down too. We developed a very, very brief intervention for practitioners, pediatricians or nurse practitioners, to raise the driving issue with a family, a parent, refer them to the website, and give them a pen, a notepad, keychain. We also had buttons for the practitioner to wear that says, "Ask me about teen driving." You know, we didn't want to leave anything to chance, so somebody might remember they should do this. We had training materials for the practitioners, primary care practitioners, and it was a motivational interviewing focus script, but really only a minute or two, and they had these materials. So it's disseminated through a new website. We could build and adapt the earlier website, but this one was more across all the states. And this is a live website that may well stay live. So feel free, I guess you do it now if you wanted, some people do, or you could do it later, youngdriverparenting.org. And again, we're measuring visits to the website and adoption of the agreement. These are the posters we thought were pretty decent looking for them to put up in their offices. This is the website welcome page. We had a lot of help we certainly couldn't have done this ourselves, but we used good people who knew how to make it attractive and user-friendly. We had a state map. You can click on any state and go to the GDL laws. Under the parent resources, this is the sign-in page to start your own agreement. And we had learned in focus groups people would be very antsy about signing up for anything on the web. So we tried to reassure them that this was safe. especially through the message from the primary care provider. This is safe, this is free, this is effective. Why not go there? So here's the way the agreement looks for Jane. She has her first checkpoint all filled out, and if you want to add a checkpoint, you go to here. Whoops, I went backwards. And you can add a new checkpoint with whatever specifics you want. So this complicated thing was in our proposal, and we think it was a decent way to think about how to evaluate translation. And for the pediatricians that I worked with, they kept thinking this was a randomized controlled trial. I don't know how many times, each time we presented updates every 6 months, we'd have to say, we don't have a control group. We're trying to see how well this funnels out and how many people you can get to the website. So there were different layers. We had to get it out there, and then the website. So we wanted people, we were using words from translation research, which was still kind of new. Our reach was, again, hearing about the message, going to the website, exposure, exploration, looking at the materials, access, downloading, initiating, make an agreement, adoption, sign an agreement, maintenance, use it. So that's what we were trying to do, hoping eventually it would affect health behavior way down the line. So here are some results. We're still analyzing data, and we don't yet have the data from the primary care providers in terms of their experience. But we had 133 participate, and they reached 3,947 families. And Google Analytics here had 2,000 some visits, and they were longer, 3.4 minutes and 4 pages. And a lower bounce rate, only 50% or under 50%, just looked at the home page and left. 10% registered to use an interactive agreement. There are 155 agreements there. And they have accessed the page. Some people might just print out a sample agreement and use it on paper. So we were pleased that they accessed it more, and they accessed the rules for Teen Driver. They visited different pages. We were pleased. They learned about teen risks at the highest number. Registration page had a lot of visits. The GDL laws, a lot of visits. The parent's role, you might wish for more of those. And the agreement pages. So in a way, this personal approach did better than the media promotion in the other study. And in terms of dissemination, the American Academy of Pediatrics is now willing to have this website on their big, huge website with all that advice parents go to for child safety seats and everything else. I hope parents can find it. We haven't gotten to that part yet. Actually, the minute I get back, I have to meet with our technology transfer office and figure out the wording of this copyright transfer. Heck, I just was happy to have them have it. Now I have to understand all the legal words. 13 pages. Oh well. So we don't know yet if the Academy will promote this or whether we can get this into routine best practices. Pediatricians think they see more teens than they actually do. So there may be other settings that are good for this to be disseminated through. So what have we learned that would help parents help their teen drivers? And you can help me answer some of these later too in a discussion, but we've certainly learned that our goal of having parents and teens communicate, negotiate, talk, sign an agreement, that's where we're headed, and we've learned parents can make a difference. They have to be engaged, a little more challenging than we had hoped. Checkpoints works. It is evidence-based. We just need to figure out how to get more parents to use it. And as I said, the personal connection seems to work better. I think people like to be reassured this is a safe website. In fact, when I was just looking at our website a couple days ago, a lot of things were coming up on Google that judge, maybe you know the name of them, spam websites, and is this a trusted website? And it was kind of scary because I'm not sure they're any better either, but it's a busy time out there. Is that one real or a test? Okay.
It's all clear.
Oh, we've been worried this whole time. Thank you for not evacuating. So we have training materials ready for driver educators. We have the video, the protocol, the script. We have website. At least one of them is going to stay alive. So these things are ready to be used. We could see more driver educators delivering this program. I gave a talk one time and a woman came up and she said, our church group celebrates when teens reach a certain age. We would love to do this. So that was a new idea. There are certainly other groups that might. Primary care providers, we could extend our reach. High schools, parent organizations. More and more states are requiring a parent meeting before teens get a driver license, although it's only 2 or 3 so far, and they don't have a very well thought out curriculum for the parents. So it seems to me this little 20-30 minute brief intervention that we did might be, especially since it's evidence-based, might be a good thing. If you're going to require a meeting, use something that's been thought through and tested. There might be parent-to-parent approaches that could be used, but we certainly need to think through how to reach these parents better. And we're all struggling with how to get our research into practice. We're trying to build on what we know works, build on good theory base. We're constantly dealing with well-intentioned, naive people who think they have the answer. Let's just have a school assembly and get all these kids crying and weeping over some sad story and that'll change their behavior for years after. Doesn't work. We have to try to avoid those and share the results of our efforts and do some advocating for implementation. So these efforts are very interdisciplinary, need to be, but we probably have to figure out a much more comprehensive, coordinated approach to reduce teen driver injury. I think our young people are worth it. And I want to thank Pat again with the last thing I wrote on this tribute from years ago. She stimulated ideas, built confidence, ignited enthusiasm through her interactions with others, left an admirable legacy. Her professional and personal influence will continue, manifest in commitments being made and lives being led by the many people she uniquely touched during her lifetime. Thank you. Okay, I'll take the questions now. Comments? Have you done anything like this? Is there a better way to do it? Brilliant ideas? Yes?
Is anybody doing research to get parents to teach, to set a better example?
That's a very, very good point. And we recently completed a nationwide survey with Toyota looking at distraction, all different kinds of distraction, not just texting. And the parents were pretty bad. The kids were worse on certain things, particularly music and entertainment type things. But our purpose in asking both the parents and the teens, and a subset were from the same family, was to be able to point out that the role modeling is pretty darn important. The more the parent did it, the more the teen did it. And there's no better time than when, well, kids are watching you from the time they're in their baby seats. I had a colleague who used to say her friend told her that she would be negotiating a very tricky intersection and kind of muttering to herself, and from the back seat would come this, "Mommy, was that a bimbo or an idiot?" They are learning very early, and that's a terrific point. There's a new study we need to do. Thanks. Luke.
Jean, on the pediatric study, you pointed out that medical visits may not be the best way to reach adolescents. I'm curious, what was the coordination between this intervention by pediatricians and the timing of potential licensure by these teens? Because the teen visit could be at 13, could be at 14.
That's right. And every time I met with the PROS coordinators who were helping the practitioners in their regions do this, they would ask again, now what age are we supposed to target? Well, every state was different. We had 16 states that we were primarily focused on, the larger states or the really eager beaver states. But we had to say things like, if you have a teen or a teen's parent coming in the office around the time they might be thinking about getting licensed, grab them now. We don't know yet the ideal time. You know, we did the checkpoints work thinking right before they're driving alone would be really a good time. And some parents would tell us they wanted the information earlier. Maybe it'd be good for them to be thinking earlier and looking at websites and getting educated. But if you only have one shot, you'd like it to be at the teachable moment. And that is a very tricky thing. In fact, at HSRC yesterday, we were talking about a study they're doing and trying to figure, you were there, or at least for part of it, when is the ideal time to reach people? If it's too early, it's like not my issue yet. If it's too late, it's sadly too late. So that's how we answered it. And in fact, the first line of the script we gave them, which of course they personalized, was, are you and your teen thinking about his getting a license soon or something? So that they could, if they said no, obviously that wasn't their teachable moment. Other comments? Yeah.
Are there any ideas that you can think of in trying to get parent involvement and wanting to do? I also work on a study where we do an intervention with parent teens, different topic, but finding kind of the same thing, that it's, you know, we're making it as easy as we possibly can, but you're still not getting that, it's not being done by 100%, even though you're making it so easy. So are there any ideas that you have thought of through your research on how to get this involvement that is so important with, you know, our youth?
One other that I remember trying to do, and we were doing this sort of for recruitment for a study too, was going to workplaces where you might be able to chat with folks at lunchtime. Trying to make it easier and easier for them to attend to this message. Find them where they are. The other thought might be parent to parent, but then you have the social networks that are just sort of individual and maybe slower. I'm open to ideas too. There's lots of media. I don't know how many people even read a newspaper or go online to read news. Facebook, we tried that, at least to get them to go to the website, and the Facebook ads were targeted to a demographic that we were told was the group who might be likely to have teens in the household. So it's a constant challenge. Does anybody else have a good idea for that? Might as well. Yeah. Or a bad idea. We'll just take ideas.
Is there any role for auto insurance companies to play in incentivizing the agreements?
Auto insurance industry has taken a role, and many of you know there are various agreements. If you typed in agreement or parent-teen agreement, you'd get MAD, State Farm, Allstate. They have them. Apparently their insurance agents who you think might be good at it if they're working with a family and adding a teen for insurance, which they often don't do, I hear. But they don't all care about it. They're not consistent in their effort. And most of those well-meaning things haven't been evaluated. CDC, at the same time they funded our study with the pediatricians, did their big media thing with Parents Are the Key, and we were like, wait a minute, there's two different things out there, but, you know, they were from different offices, I guess. Anyway, yeah.
Well, I don't have any kids, so this is worth the paper's printed on. But I have observed, mainly observing my brother and my sister and my kids, parents love to compete. And they really love to compete via their kids. So if you could get some situation where, of course, voluntarily, these parents are competing via their kids to succeed better at this and win prizes, I bet you could get up to 38%.
Well, that might be worth the paper it's not written on. People do like to compete. They like games, they like prizes. We all like free stuff. So yeah, we can do that. And of course, we're competing on the web with video games that have millions invested in them for kids' attention and even parents. It's hard to get anything that glitzy. I like the idea of prizes. Are you willing to donate? Good, okay. Question?
I'm just wondering, back to the insurance idea, maybe the insurance companies can offer incentives or discounts on insurance fees.
Yes, and at least one company has a discount for the good student. Not that there's any correlation necessarily between high grades and no crashes. And then there's at least one company that offers a discount for those who put a drive cam in their car for when the teen is driving alone. The parent can get feedback electronically on how it's all going. We've done some studies with that, as has Rob. So that's a decent approach, because money talks, and if you can't give a prize, you could give a discount. Yeah. Good, you're all thinking about it. That's terrific. And maybe we can keep right on talking about it. Is there any wrap-up we're supposed to do, or?
Thank you, Jean.
Thank you. Thank you.
Get your button.
Yeah, my button.
Visit that website. And
That's Liz's, I think.
Jean, thank you for coming and spending a
Thanks.
couple of days with us here. It is a real pleasure to have you with us. And, you know, I think it's a great message that GDLS is just, I think a lot of us feel like, hey, we're doing great if we comply with the law, you know. We need to be ready for the parents who are willing to go beyond what's mandated by state law. And so, thank you for helping those parents get beyond what's mandated. Because I have personal experience of this issue, having an indestructible 17-year-old man. It can be hard to modify teenage behavior. But for those teenagers whose behavior can be modified by their parents, which I still contest is the minority, it is great to have people like you with it. So you are truly a wonderful loft.
Thank
Very
you.
good success. So thank you.